filibuster-free zone, folks, so you're not going to get a big speech from me. And the reason I wanted to come especially is it looks like this issue is going to be on the floor of the United States Senate next week. And I wanted to make sure that there was another opportunity. We've had several along the way to make sure that rural Oregon could be heard from, but I said, I got to be there, and so I basically flew until the middle of the night in order to pull this off, and I just want your voices to be heard. Suffice it to say, we call it in our office the big bad bill, and in particular, I'm struck by the fact that the bill actually got worse in the United States Senate than it was in the House of Representatives. And you really have to work at spending trillions of dollars of new money and still making more people in poverty, creating more people in poverty. And that's because this is basically a proposition that we're going to give tax breaks to billionaires, and it's going to be paid for by folks who depend on Medicaid and programs to help with hunger. Now, I had been hoping that Dr. Mehmet Oz would be sitting next to me, and I thought that we would get him to Oregon by now. In his confirmation hearing, he at one point said that we could afford some of these reductions in nursing staff because AI would take care of it. And when he said that, I said, are you kidding me? Are you kidding? You're not going to be able to take care of the needs of an 85-year-old woman on Medicaid who needs help getting to the bathroom. So I believe the reason he's not here is that he knew that being here is he'd be asked to defend the indefensible, which is what I think this legislation is all about. So what I think we'll do is, pull the curtain back a little bit on what he and his friends are doing 2,500 miles from here and talk about what's really on the line. The Congressional Budget Office is the nonpartisan counter of bills and does it for Democrats and Republicans. They say 11 million people are going to lose their coverage, but when you count the number of extra people who are going to lose their coverage through the Affordable Care Act premium credits, it gets to be about 16 million people. So the people at the very top are going to get new tax breaks and in some cases millions of dollars. And folks that we're talking about, and I just had a chance to talk to some of the wonderful people at Head Start, are going to essentially see their services reduced. In addition, they're going to be $500 billion in Medicare cuts as a result of the new bill. So you hear a lot about the reductions now in some news outlets in terms of Medicaid. Nobody heard much about Medicare cuts, but all of you know there's a group called the dual eligibles, people who are eligible for Medicare and Medicaid who are also going to suffer. And the numbers, particularly in rural Oregon, take your breath away. In Malheur County, more than half the residents count on the Oregon Health Plan, which is our version, of course, for Medicaid to get decent health care. So that sets the table a little bit. That's a couple of the numbers that are being used by legislators to look at it. But it's one thing to hear about numbers 2,500 miles away from the Congressional Budget Office. It's quite another to hear your stories, as I just did with the wonderful folks at Head Start. And now I want to hear from all of you with respect to Medicaid. So with that, why don't we start off and